always ask what a person's sleeping habits are. So what we have here is a chronic SI and a chronic, and particularly fairly recent mid-back problem, mid-back discomfort, mid-back junk. Just nothing seems to get rid of it. Many osteopathic treatments. But we have a stomach sleeper. Always ask what the sleeping habitus is. Stomach sleeper, Dr. Chikowitz. And chronic stomach sleeper has not been able to break the habit, so he's cut off all his venous and lymphatic, return, and therefore and I noticed that he has a circumoral pallor, paleness around the mouth and the face, and then the darkness under the eyes. This could all be from the inability to get some good venous and lymphatic drainage. There's no bony prominences on the abdomen, so there's the pressure. This is enough pressure to cut off the venous flow and lymphatic. So imagine all night long in that way. So there's a fair amount of lumbar lordosis, as you would expect from the stomach, the prone sleeping habitus. So that's going to impact the upper thoracics. And there's massive congestion in the pelvic bowl. So, I mean, I can just feel the congestion. So, that congestion has to be rectified for this condition to be resolved. And that means that it's time for the tennis ball. And a tennis ball in a nylon. Do women still have nylons, Mr.? So you can go get a nylon if your wife doesn't have, and just put the tennis ball in it, and then you're gonna have her, or you whatever, wrap it around yourself at night. You're gonna do that. And then when you fall asleep on your right side and your left side, don't do the back. Back also causes problems. Too much strain on the thoraco-abdominal diaphragm. And then when you roll over, it's gonna be a little bit unpleasant.
Sure.
Now you could use a baseball and get it major unpleasant. So there's going to be a lack of diaphragmatic excursion going on, and that's just automatic. So where's the doctor's wallet? I'll use this wallet. I got to palpate the wallet anyway. I got to make sure there's enough in here.
Don't carry much cash.
Nobody does.
All on the credit cards.
Yeah, I can see that. So what we see is an inordinately shallow respiration and no respiration to the pubic symphysis. And there's just no respiration. It's just so shallow. It's pumping, but pumping in a shallow fashion. So then there's just an issue, So now what are we going to do? The problem is in the upper thoracic region. It's just passive congestion. That's going to be sore. That's not too bad. I'll let this in this. So for the passive congestion issue, we're going to start by treating the thoracolumbar junction. And the pain's up in here, isn't it?
Yeah.
I don't know, is it painful to touch? Not so much.
No.
Okay, so that's the diaphragmatic. Okay. Take a deep breath in and let it out. Follow the fascial planes. There we go. Take a deep breath and let it out. So that's some major articulation going on in the thoracolumbar and the lumbosacral, and now the back is flat. And we can check the respiration to see, because there has to be some improvement and excursion from taking out the myofascial strain pattern. And let's just see. So shallow. That's better. Just a little bit better. It's such a chronic issue. Now, I'm going to really take out the lesions aggressively in the thoracic spine. So all the way up. Lift up your head. There we go. Notice I'm just gonna leave the hot spot alone and walk around. A deep breath in and out. Treat the pubic symphysis. Squeeze your legs out.
Push them out.
Yeah. Relax. Now do it again. Relax. Now together. That was an articulation and a half.
Mm-hmm.
All that strain from postural issues.
Mm-hmm.
So now I gotta work up to the thoracic area, thoracic inlet. There's a lesion there. Lift up your head. So now take a deep breath in. Let out. Then I gotta deal with this thoracic inlet situation, the first rib. Second cervical is going to be a problem from the, it's a problem that's rotated to the left from the, again, the posture. There it goes. And probably the third. How's the occiput? That's got to be under strain. So the occiput's, there it is. Oh, I don't need that side. Now sit up.
Okay.
Drop your legs off. Mm-hmm. Slide your hip behind back. Now I'm going to look specifically, Chikowitz, for the lesion that you've been working on, and see if he can point it to me. And I'm going to try my best to do what you were doing with the double arm or the chicken wing, whatever you want to call it technique. But what do you got? Is it here? Is it down further?
It's a little lower in terms of like the paper towel.
Okay. Here?
On the right side mainly.
On the right side.
Yeah.
Well, let's see.
But again, there's a few areas. So.
Yeah. There's. Okay, so here there's a side bent left lesion, and it is down a little bit lower, about T5, T6.
Mm-hmm.
So let's see. Since side bent left, you knows the drill. Drop the neck, drop the chin down there. Now put your hands over mine. There you go. Lock them together. So side bent left, I gotta take him to the right a little bit, to the neutral point, and then just relax. Loosey goosey, loosey goosey. Take a deep breath in. Pull down, pull down, pull down. That was low. That's pretty good here. A little bit there. So we'll go a little higher.
Mm-hmm.
Rub the elbows down. Loosey goosey, loosey goosey. Take a deep breath. Let it out. Pull down, pull down. Here it goes.
Mm-hmm.
Okay. That's it. We can take a lay down and see how the diaphragm's doing. Just on your back.
Just on my back again.
Yeah. Oh, that's so much better. I think that's evident to anybody. You know, the excursion is going to be good. All right. Okay.